Okay, thank you. It's organized with much excitement and enthusiasm. The Congress will be open to all members and non-members of the society, practicing vascular surgeons, vascular specialists, and other allied health professionals interested in further expanding their knowledge in the field of vascular and endovascular surgery are invited to the Congress. The scientific program of the Congress will feature world-renowned leaders who will cover everything relevant in the arterial and venous areas. You will be afforded valuable insight as faculty will address the latest scientific and technological advances related to vascular and endovascular surgery. At the end of each panel session, registered attendees will have an opportunity to ask questions. Industry will be available, and we encourage you to visit them at their booths during the breaks to learn more about their technologies, products, and services. For without their support, this Congress will not be possible. You will also have an opportunity to network with colleagues and industry professionals throughout the globe. The history of this society demonstrates that this is the oldest European society in cardiovascular surgery. Always maintained a high degree of competency in their strong interrelated fields of cardiac, vascular, and cardiovascular surgery, with respect of each specialty, and always permitted a wide forum for technical and socio-cultural interchange. We, as a European Society of Cardiovascular Surgery, formed an agreement to take place either side of both society congresses by forming panels by each side. This will increase both social and scientific relations of the societies.
Okay, so thank you for the interview. So this Congress in Belgrade will be focuses on some cardiac issues. There are three main topics. The first topic will be on aortic valve reconstruction, how to reconstruct the aortic valve by different techniques. And this field is very progressing rapidly. The second symposium will be on left ventricular assist devices and heart transplant and ECMOs, which also is a growing field with more and more surgeries being performed for heart failure patients. So the third area of the program will be on aortic valve and the new sutureless technique of valve, which are being developed, and also all the growing field of transaortic valve implantation, which is very, very rapidly growing. And also we will talk about the new implantation for mitral valve and also for mitral valve plasty. The last symposium, but not the least, will be on atrial fibrillation, using various techniques for the surgeons, using epicardial ablation, and the results and the new developing field for this treatment.
So first of all, I would like to say that starting the position of Secretary General was a great challenge for me and very great experience. So I would like to say that many things were managed in the correct way. For example, to do more friendly our website. We completely changed our website, so I think that now the domain of ESCVS is much more user friendly than it was. The second one was establishment of new schools, so-called summer and winter schools for education of young generation of vascular surgeon, cardiovascular surgeon, and cardiologists, and many disciplines which collaborate with vascular and cardiovascular surgery. The aim of these schools is to spread the basic knowledge of these areas to the young generation and to give more information about the important diagnostic, treatment and follow-up issues in the treatment of our patients. And the third, last not but least, thing was to do more precise yearly congresses. So we put our stress to much more better organizing of year congresses in various parts in Europe. So I think that we manage these three things in the last 5 years of my position as a Secretary General. There are many issues in front of our society, but we would like to spread a lot of knowledge among our young colleagues, our young surgeons. So we will put the stress on organizing the education schools, like I mentioned, summer and winter school in various parts of Europe. Also, we would like to spread activity of ESCVS not only among the European countries or United States or South America, but especially to the Eastern countries and Africa countries, and we will concentrate to this direction of spreading our knowledge to the East countries. And the last issue probably is to concentrate to organization of very good congresses which are organized each year by our society, and we will put stress on a perfect organization, especially from a clinical point of view and clinical research and experimental research project, and we will do the best to fulfill these challenges, and we will try to receive more and more participants each year. Belgrade is a very nice, lovely city with very nice people, and historically very nice hospitality. And I can recommend each of us to participate the ESCVS Congress next year in 2016 in Belgrade.